Thank you for being here today. My name is Nick Yanek, and I'm a first-year med student here at UT. Today, I'm going to be presenting on our Suture Tech program that is pretty unique to UT, I think, in particular. And it's really based on providing medical students with a fantastic opportunity that I think will come to light as we go throughout the presentation, while also benefiting our hospital system and really improving our emergency department efficiency. So as a brief little overview of where we're going to be going today, we're going to first set the environment and the situation of where our Suture Tech program really became and developed out of. And then we will go into the more specific steps of how it was developed, some considerations within that, the risks and benefits of our program, and then finally end with some recommendations if you want to take something similar back to your own institution. So Regional 1, briefly pictured here on the right side, is home to our Suture Tech program and many of our rotations here at UT. And I want you all to just take a little flashback to maybe when you were in high school, or whether that was recent, maybe longer ago, whatever it may be, and think about when you were probably playing sports. I don't know if you were on a basketball team, let's say the volleyball team, football, whatever it may be, and it's Friday night, Saturday morning, it's game day for you. You go for that spike, you go for a layup, you're going to score that last touchdown, whatever it may be, and bam, you get hit from the side and you get fallen to the ground and you are in immense pain and your leg hurts incredibly, terribly bad because you fractured it. So you go to the emergency department and you go to check in and you're stuck waiting. And the nurse comes back over and she says, oh, there's more patients that are more critically in need of you or of care than you right now. So you'll have to keep waiting. So then you keep waiting more. And before you know it, it's 3 hours past until you finally get seen and get taken care of as you need to be. So that is a very common situation that we see in emergency departments across the US, and Regional 1, sadly, is no different than that. We have a few different factors that kind of contribute to the overburden that you can see in our emergency department. One, we are the only level 1 trauma center within a 150-mile radius of the region. So we are taking care of very critical patients from a wide range of area. We see over 17,000 patients per year in our emergency department alone, and over 1,500 patients with gunshot wounds in particular. So as you can imagine, let alone any other wound you might have or any other critical care that's needed to get taken care of, those numbers are very high. So that's where our Suture Tech program really became born. Our founder back in the late 80s, so the program has been around for about 30 years, saw that our labor was very overburdened in the emergency department and we needed to help our patients get seen quicker. So how else to do that? Then of course, approach your own medical students, always ambitious and ready to work and get that extra experience in, while also being a very cost-effective option for a hospital. So first we saw the demand with that overburden that we had mentioned. Again, figuring out that medical students would be a great target audience to kind of recruit, being our second step. Again, we are looking for those competitive edges when it comes to residency applications, and Suture Tech really gives hands-on experience in basic wound care with patients, as well as, again, being a cost-effective option. So we're able to recruit our medical students by having monthly signups, and all the shifts are open every single day of the week from 6 p.m. to midnight, and on weekends, there are additional shifts that go from 6 p.m. until 6 a.m., which provides immense opportunity to really get hands-on experience, as said already. Finally, the next step, thirdly, training. So, how are medical students able to have the capacity and the ability to provide quality sutures when typically that's done by our physicians? Well, our medical students begin Suture Tech really starting their first year of medical school, where they're required to have 150 hours of hands-on shadowing experience with fellow suture techs and other healthcare employees to really understand the basics of wound care. The goal here with our training is not to necessarily, compete with our physicians that have thousands and thousands of hours of training in this space, but rather have a very niche subset of skills and be able to execute this still effectively while being able to provide those quality sutures. So with training, that first year that started, we needed, of course, our clinical staff to be able to do that shadowing and do that training. But once our medical students reached that 150 hours, they were able to, pay that forward essentially, and now be the shadowing kind of capacity for future classes to come through. Then funding, of course, is always a concern. So as mentioned, it's very cost effective. We pay our medical students $15 an hour, which is a great bonus for them. We, are poor with lots of student loans typically, so we love to get a little bit of extra pay where we can. This also means that we're employed by the hospital, which gives us the employee insurance that is needed when providing such care, which is a very critical component to that. And at $15 an hour, that is substantially less than what if you were to break out a physician's salary by hour, it is much lower than that. If a physician, let's say, makes $200,000 a year, if you take that by a typical, I don't know what a physician's specific schedule is in the ER, but if that's broken out by 50 hours a week and 40 hours per week, that is $100 an hour. So that is 15% of what we're paying a physician to do. Very similar care. Again, though, our medical students doing basic wound care, not the most complex situations here. And then finally, approval. We needed to get both our hospital approval as well as university approval. We were really able to lean into the aspect of course, being an academic medical center and leaning into the mission and aligning it with that of how great of an opportunity this is for medical students to have a unique experience in getting this hands-on care. And then the hospital, of course, greatly benefited, again, with the cost effectiveness, as well as being able to really work our physicians up to the top of their license while using medical students to perform the more basic needs that we saw in the emergency department to help with that patient throughput. Now, that goes without saying, there are, of course, risks and benefits to every program, and Suture Tech is not, immune to either of those. Some of the risks that we had to consider was billing capture in particular. This one came up as a large concern for making sure that we're capturing all the respective units of care that are provided. And, with Suture Techs not necessarily being under the physician's watch with that, you're making sure that the billing is being captured appropriately. There were some considerations here with us being a public hospital, and they were okay if they were to miss some of that capture. And so if you're in a private institution, it might be a little bit different, and you might have a little bit more red tape around that situation. Next, as we talked about quality insurance with the suture wounds and the Suture Tech's ability, we, of course, have this as a concern given that it is a medical student performing basic wound care. However, we do stay up to date on the literature annually and making sure that 150 hours is an adequate amount for our Suture Techs to be exposed to what they need to be exposed to and to gain those skills. And then finally, shift coverage. We put this as a risk as we do not assign shifts, but rather people are signing up for the shifts. However, we have yet to see this really be a risk. Again, medical students being the wonderful type A gunners that we love to see, always on top of it. And people even set alarms literally at the time that it comes out every day of the month. And those shifts go very quickly. So people are always competing for filling up those spots. But with it not being an assigned shift, it's always worth noting. Finally, though, the benefits, as we believe, as the program's been on for over 30 years, greatly outweigh those risks. And one being, again, the reduced cost, as mentioned earlier, with Suture Techs being paid $15 an hour and still being able to help with that patient throughput. Kind of going into operational efficiency as our second benefit, again, this helps really work people up to the max of their license and get more patients through the ED in a quicker fashion while still providing quality care. And then finally, the student experience and match rate, which is unbeatable. Out of all of our Suture Techs, 100% always match, which is a great stat to have. And they are typically either going into Gen Surge, which is 4 out of the 5 Suture Techs we have every year. And then the other, individual is usually in trauma or ER, some sort that is, adjacent to surgery. And then finally, that student experience component. Again, this is really giving a lot of hands-on experience and in our emergency department in particular, seeing the level of care that we have to provide and the number of gunshot wounds that we see in particular. This is something that is very unique, I think, to Memphis and to UT in particular, where a lot of other medical students don't have the same exposure that our students do that are part of the Suture Tech program. So with that, to put on the summary for some recommendations that might be a good indicator, Suture Tech would be a good expansion into your institution. First, kind of tying into demand from earlier with the development of our own program. Some key indicators here would be, also being a level 1 trauma center, being a high volume, and also being in a metropolitan area. A lot of these coincide together. So any one of these three or all three of these things are helpful indicators that you have a very high patient throughput, of course, and might see some burden that you see with your labor constraints. Next, the capacity, one being the capacity of your medical students. Again, as noted, this is a risk in theory, but again, being the gunners that medical students are, they are typically more than happy to fill this capacity. But the other piece being your staff for training, especially in that first year where the staff are going to be needing to supervise those first years of Suture Techs coming through. It is important that you have their support and their approval and their own bandwidth to be able to train medical students. And then finally, support not only from your staff as mentioned, but into your academic medical center and being a public hospital. Those are some good indicators that your hospital admin will be more on board with this program. And then being a university, really trying to tie in that mission alignment. So want to bring it back to that original story. You were in high school, had to wait for hours upon hours to see that doctor. Whereas now, flash forward to today, and you might be a parent yourself, and your kid is going through the exact same situation. They also get, pummeled to the side and unfortunately break their leg as well during maybe their sporting event, but they're able to go to the emergency department. And within 45 minutes to an hour, they are seen by the doctor and being able to get taken care of much faster than you were. So if you have any questions, I believe we have some time right now, but also feel free to know our emails, or you can also add us on LinkedIn. And if we don't get to your question, you can always reach out to us. Yes. Oh, pediatric cases? Actually, I'm not sure if they do. Um, from what I've heard, it's typically more adult cases, but that's a great question. I can find that out and get back to you. Yeah. I believe it's just the suturing. So that's it. And it's the more basic levels of suture care. So yeah. So in the first year, as many people want to shadow, they can. And then the ones that hit 150 hours are eligible to apply to be like with the title of suture tech, and that will last in your second, third, and fourth years. So I guess I probably should have, worded that a little bit more clear. So I'll go through a little bit. So you shadow throughout your first year, get those 150 hours. Very difficult to do, just obviously accumulating that amount of time. But then again, those that do that can then apply. And then throughout the summer, from their first to second year, if you're selected as one of the 5 people that are a full-fledged suture tech, you get a lot of training that summer when there aren't any first-year medical students to supervise yourself. And you are able to now be not supervised by a physician or anybody throughout that summer since you hit your 150-hour mark. And then when the fall hits, let's say you're an M2, the M1s below you can now shadow you, and then you don't need a supervisor above you. So, oh yeah. Yes, so the physician will first see, and then if it is a basic case, they can pass it along to the suture tech. And if it's more complex, then they'll take it from there in their own kind of route. But the physician will see them first to check that box. Sweet.